there was something nobody talked about. For decades, menopause was treated as a simple, almost bureaucratic event in a woman's life. Someone would say hot flashes and end of menstruation, and that was it. The subject was closed. There was no room for deeper questions, for the accounts that hung in the air, for the stories women kept to themselves because they believed they were the only ones living through it. This investigation began exactly there, in an uncomfortable realization that the official narrative about menopause was, somehow, incomplete. As the process of gathering accounts, studying research, and listening to women of different ages and backgrounds began, what emerged was disturbing in its clarity. Menopause is not just the end of menstrual cycles. It is a silent revolution that moves through every system of the female body, leaving traces that are rarely identified correctly. And the symptoms that frighten most, that confuse most, that isolate women most, are not the hot flashes that everyone knows. They are others. They are 8 manifestations happening right now, in bodies that have not yet received the correct diagnosis, in minds still trying to understand what is happening to them. To understand what lies behind these symptoms, it is first necessary to understand what menopause truly represents in the body. It is not simply the pause of menstruation. It is a deep and systemic hormonal transformation, marked by the progressive decline of estrogen, progesterone, and in many cases, testosterone as well. These 3 hormones do not act only on the reproductive system. They regulate the brain, mood, metabolism, bones, muscles, skin, heart, and sleep. When they begin to decline, a process that can last years before the final period, in the phase known as perimenopause, the entire body needs to reorganize itself, and that reorganization rarely happens in silence. The first symptom that shocks women and is rarely associated with menopause is sudden anxiety and irritability without apparent cause. Women who never had a history of anxiety report waking up with a racing heart, feeling fear without any clear object, exploding over small things, crying without being able to explain why. Friends and family notice the change. The woman herself notices. And almost always the conclusion is, I'm too stressed. I need a vacation. Maybe it's depression. What few people know is that estrogen plays a direct role in the production of serotonin and dopamine, the neurotransmitters responsible for emotional balance. When estrogen drops, these chemical messengers also fluctuate, creating an unstable emotional state that has nothing to do with weakness or character instability. It is pure biology. Shortly after comes something that many women describe as one of the most terrifying symptoms: brain fog. Frequent forgetfulness, difficulty concentrating, the feeling that thoughts are slipping away, the inability to recall common words mid-sentence. Highly competent women, who managed teams, ran businesses, raised children, and studied all at the same time, suddenly begin to doubt their own cognitive ability. Some begin to consider neurological diseases. Research conducted at the University of California, Los Angeles, demonstrated that the drop in estrogen directly affects the hippocampus, the region of the brain responsible for memory and learning. Menopausal brain fog is real, documented, and treatable. But before treating it, it must be recognized. Fatigue is the third symptom that frequently goes unnoticed in its true origin. It is not simply the tiredness of someone who slept poorly. It is a deep exhaustion that persists even after a full night of rest, that does not improve with caffeine or recovery weekends. The woman wakes up already feeling the weight of the day before it has even begun. Doctors frequently associate this fatigue with stress or an overload of responsibilities. And sometimes those causes are present as well. But what is rarely said is that sex hormones play a fundamental role in regulating cellular energy. With the drop in estrogen and progesterone, energy metabolism changes. Mitochondria, the energy powerhouses of cells, function differently. And the result is a tiredness that seems to have no end. Sleep disorders appear as the fourth symptom and work in cruel synergy with fatigue. The woman is exhausted, but cannot sleep. Or she sleeps, but wakes in the middle of the night with her body on fire, heart racing, mind spinning. Or she simply wakes at 3 a.m, completely alert, and cannot fall back asleep. Estrogen plays a direct role in regulating body temperature and the architecture of sleep. When it drops, the so-called night sweats, waves of heat that occur during sleep, disrupt rest even when the woman does not remember having felt them. The result is a devastating cycle. Without sleep, anxiety worsens, brain fog deepens, fatigue increases, and everything begins to feel unsolvable. For those seeking natural support during menopause, I have left the first link in the description with an option developed to promote hormonal balance and a smoother transition. The 5th symptom is one of the most visible and, at the same time, one of the most misunderstood: changes in weight and body shape without any significant change in diet. The woman swears she is eating exactly as she did before, but the scale goes up. Worse, fat begins to concentrate in the abdominal area, even in women who never had that pattern. The waistline disappears. The body seems to change shape without asking permission. This fat redistribution is directly linked to the drop in estrogen, which influences where and how the body stores fat. With the hormonal decline, the body tends to prioritize visceral fat accumulation, the most dangerous from a cardiovascular and metabolic standpoint. Attributing this symptom to lack of discipline is not only inaccurate, it is unjust. The 6th symptom is perhaps the most silenced of all: the feeling of loss of identity. It is difficult to describe, difficult to name, but countless women report it in surprisingly similar words. They say they no longer recognize themselves, that they have lost the thread of who they were, that they feel a kind of grief without a clear object. Emotional sensitivity increases. Movies that never moved them before now bring tears. Words said in passing wound with unexpected depth. The woman wonders if she is going crazy, if she is overreacting. She is not. Estrogen is directly involved in how the brain processes emotions and builds the perception of self. When it fluctuates, emotional identity fluctuates as well. Recognizing this as a hormonal process, and not as a personal failing, can be liberating. Joint and muscle pain form the 7th symptom, and they frequently arrive even before any change in the menstrual cycle, which makes them all the more disconcerting. The woman wakes up with stiff joints. Her knees ache going upstairs. Her shoulders feel heavy. Her hands are stiff in the morning. Rheumatologists are consulted, tests are run, and often nothing is found. What is not explained is that estrogen has significant anti-inflammatory properties. When it drops, inflammation in connective tissues increases, joints lose part of their natural lubrication, and muscles become more vulnerable to pain and fatigue. It is a real symptom with solid physiological basis. It is not anxiety manifesting in the body, as is still said by some unprepared professionals. The 8th symptom is the decline in libido and disconnection from one's own body. And it is not simply about wanting less sex. It is a broader disconnection from pleasure, from sensuality, from the perception of one's own body as a source of well-being. Vaginal dryness, caused by the drop in estrogen, makes sexual intimacy painful. Desire simply stops appearing, as if it left without saying goodbye. Women report feeling shame about this, guilt, fear that their relationships will deteriorate. Partners become confused. The silence surrounding this symptom is enormous and unjust. Testosterone, which also drops during menopause, is one of the primary regulators of female desire. The decline in libido is not a choice, not emotional disinterest. It is a documented hormonal response that deserves attention and care. What unites these 8 symptoms is something more powerful than any one of them individually: the silence that surrounds them. For decades, women were told to endure it, to stop exaggerating, to accept that aging means deteriorating. They were sent home with antidepressants when they needed hormonal support. They were diagnosed with anxiety when they had a progesterone deficiency. They They were accused of hypochondria when they reported pain that no test could explain, because no test had been ordered with the right perspective. The transformation begins when information arrives. When a woman can look at her symptoms and say, "This has a name, this has a cause, this has a solution." Dealing with menopause effectively involves 3 fundamental pillars. Understanding one's own body, recognizing that what is happening is a transition, not a deterioration. Adjustments in lifestyle, sleep, nutrition, movement, and stress management have real and measurable impact on symptoms, and adequate nutritional and hormonal support, which can include dietary changes, targeted supplementation, and in some cases, supervised hormone therapy. Natural solutions focused on hormonal rebalancing have shown significant results in recent studies. Compounds such as red clover extract, black cohosh, phytoestrogens found in fermented soy, and various adaptogenic plants have demonstrated the capacity to soften the menopausal transition, reducing the intensity of hot flashes, improving sleep, stabilizing mood, and supporting cognitive health. They do not replace medical care, but they can be a powerful ally for women seeking to navigate this phase with greater quality of life. If symptoms like hot flashes, night sweats, mood changes, or weight gain are part of your reality, the first link in the description features a natural supplement designed to support women through this phase. Menopause is not the end of anything. It is the end of one phase, and the beginning of another that can be lived with depth, clarity, and strength. But that only happens when a woman receives what she deserves: correct information, adequate support, and the recognition that what she is feeling is real. Ignoring the signs only prolongs the suffering. Naming them is the first act of care. Each of the 8 symptoms presented here has an explanation, has a cause, and has pathways to care. None of them need to be carried in silence. And if this content brought clarity, if it helped put words to something that felt diffuse, then it fulfilled its purpose. If you made it this far, you are already on the right path. The path of someone who chooses to understand their own body rather than simply endure it. Subscribe to this channel because the next videos will continue to explore this subject with the seriousness and care it deserves. There is so much more to discover about how to navigate this transition with health, balance, and above all, with the dignity every woman deserves.